Welcome to this month's webinar. We will review the new physical activity guidelines recently released by the Department of Health and Human Services. Then we will discuss goal setting. Let's get started with some background on these guidelines. Since 2008, the Physical Activity Guidelines for Americans has been a go-to resource for policymakers and health professionals and served as a foundation for federal physical activity and education programs. It includes recommendations for Americans ages 3 years and over, including people at increased risk for chronic diseases, and provides evidence-based advice on how physical activity can help promote health and reduce the risk of chronic disease. So let's go over the top 10 things that you need to know about the second edition of the Physical Activity Guidelines for Americans. The second edition of the Physical Activity Guidelines for Americans provides evidence-based recommendations for adults and youth ages 3 through 17 to safely get the physical activity they need to stay healthy. There are new guidelines, there are new key guidelines for children ages 3 through 5 and updated guidelines for youth 6 to 17, adults, older adults, women during pregnancy and the postpartum period, adults with chronic health conditions, and adults with disabilities. The new key guidelines for children ages 3 through 5 state that preschool-age children should be active throughout the day to enhance their growth and development. Adults caring for children this age should encourage active play, whether it be light, moderate, or vigorous intensity, and aim for at least 3 hours of active play per day. The recommended amount of physical activity for youth ages 6 through 17 is the same, hasn't changed from the first guidelines. So that is that each day, youth ages 6 through 17 need at least 60 minutes of moderate to vigorous activity to attain the most health benefits from physical activity. Now, most activity can be aerobic, like walking, running, or anything that gets their heartbeat up and keeps it up. But they also need activities that make their muscles and bones strong, things that are weight-bearing, like climbing, climbing on playground equipment, playing basketball, jumping rope, any kind of sport or, fun activity. The recommended amount of physical activity for adults has remained the same, and that is to attain the most health benefits from physical activity. Adults need at least 150 to 300 minutes of moderate intensity aerobic activity like brisk walking or fast dancing each week. Adults also need muscle strengthening activity like lifting weights or calisthenics like push-ups or things like that at least 2 days a week. We also now know about more health benefits than we did before and how Americans can more easily achieve them. The second edition of the Physical Activity Guidelines for Americans is based on the latest scientific evidence that shows that physical activity has many health benefits that are independent of other healthy behaviors like good nutrition. Now, that's not to say that you shouldn't eat healthy, but being physically active has its own benefits independent of eating healthy. The first key guideline for adults is basically move more and sit less. This recommendation is based on new evidence that shows a very strong relationship between increased sedentary behavior and increased risk of heart disease, high blood pressure, and all-cause mortality. So all physical activity, especially moderate to vigorous, can help offset these risks. So just try to move more than you do currently and sit less, and you're headed in the right direction. Also, we now know that any amount of physical activity has some health benefits. Americans can benefit from small amounts of moderate to vigorous physical activity throughout the day. The first edition of the guidelines stated that only 10-minute bouts of physical activity counted towards but meeting the guidelines. But this edition removes this requirement and encourages everyone to move more frequently throughout the day, even if you're not accumulating 10 minutes at a time. But continue to try to work towards meeting the guidelines for adults that we just talked about. New evidence also shows that physical activity has immediate health benefits. For example, physical activity can reduce anxiety and blood pressure and improve quality of sleep and insulin sensitivity. Immediate health benefits. We also now know that meeting the recommendations and the physical activity guidelines for Americans consistently over time can lead to even more long-term health benefits. For youth, physical activity can help improve cognition, bone health, fitness, and heart health, can also reduce the risk of depression. For adults, physical activity helps prevent 8 types of cancer. Now, we knew about breast and colon cancer prevention, but also now bladder, endometrium, esophageal, kidney, stomach, and lung cancer risk can be reduced with physical activity. Also, physical activity can reduce the risk of dementia, including Alzheimer's in adults. Heart disease, stroke, high blood pressure, type 2 diabetes, depression. We knew all of this already, but also improves bone health, physical function, and quality of life. For older adults, physical activity also lowers the risk of falls and injuries from falls. For pregnant women, physical activity reduces the risk of postpartum depression. For all groups, physical activity reduces the risk of excessive weight gain and helps people maintain a healthy weight. New evidence shows that physical activity can help manage more health conditions that Americans already have. For example, physical activity can decrease pain for those with osteoarthritis, reduce disease progression for those with hypertension and type 2 diabetes, reduce symptoms of anxiety and depression, and improve cognition for those with dementia, MS, ADHD, and Parkinson's disease. So now that we know all the benefits, let's talk about goal setting. You know, if you want to set a goal for success for physical activity, have a long-term goal in mind, but that shouldn't be your main goal, okay? Start slow, have some mini goals to work up to your long-term goal, which maybe your long-term goal is to attain the health benefits from physical activity for adults, which is needing 150 to 300 minutes of moderate intensity activity a week. Maybe that's your long-term goal. And also adding the 2 days of muscle conditioning that is recommended. Maybe that's your long-term goal. So just start slow and work up to it. Resign yourself to the fact that you're going to do something every day, even if you only have 5 minutes to do it. Or maybe you can only walk for 5 minutes. Just start where you're at and plan some activity every day, okay? Once it becomes a daily habit, you'll naturally start increasing what you do, okay? So think about your long-term goal, set short-term goals, maybe increase your short-term goals week to week, or if what you're doing is difficult, maybe stay there for a few weeks, and then after a few weeks, increase your weekly goal. But look, we health coaches are here for you if you need help with your goal setting, or if you have any questions about physical activity and what's best for you, or anything at all, please do not hesitate to reach out to your health coach. Thank you so much for joining. I wish you all a happy, healthy holiday season and new year. And please don't hesitate to reach out to your health coach today.